What treatment would you recommend for eye bags, lost volume and apples of cheeks after weight loss? Since I lost 65 pounds, I have really awful eye bags and no volume left in my cheeks. I look sad and tired all the time. What's the best method of improving this area? The most affordable?
Thank you for your question. You've lost 65 pounds and you have noticed that you have under eye bags and that you lost the volume in your cheeks and that you always look sad and tired. So you've asked a very important question of what is the best option, and you also mentioned affordability. So as a specialist in facial aging and cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years, this type of question is something that we deal with every day in our practice. And certainly, cost is a factor for a lot of people. So here's how we approach this situation. First, we have to define the problem, and then we discuss different options based on level of long-term benefit as well as affordability. So when you look at your lower eyelids, why are there bags under the eyes? Well, briefly, these lower eyelid bags are the result of lower eyelid fat prolapse. Lower eyelid fat prolapse means that's the fat that's normally around the eyes and in spite of your weight loss still remains and is pushed forward. And that results in this puffiness under the eyes. Just as a side note, the under eye bags or the fat around the eyes is typically the last fat in the body to ever go away when someone loses weight, and usually that's more common in people with malnourished situations where they've really have broken down so much of their body's natural tissue in addition to muscle that before that fat goes away. So don't think about losing more weight to try to reduce the under eye fat pockets. The approach to the lower eyelid fat prolapse is to perform a lower eyelid blepharoplasty. Now this can be done in two different approaches, one from the outside called the transcutaneous approach and one is from the inside called the transconjunctival approach. The decision on that is based on several factors and physical examinations. Most of our patients, we perform this type of procedure from the inside of the eyelid called transconjunctival blepharoplasty, and that's to avoid the external incision. But at the same time, in order to make a decision on which approach, you have to have a physical exam. The lower eyelids are actually deceptively complex, and many plastic surgeons end up creating results where the lower eyelid is pulled down or retracted, sometimes even everted, because the lower eyelid has a lot of critically important anatomic structures that need to be in balance in order to get a good result. And so that distinction has to be, or that particular choice has to be made based on a physical examination. When we also evaluate the lower eyelids, we also look at skin quality and texture. And so we would also consider procedures such as fractional CO2 laser, as well as the use of platelet-rich plasma derived from your own blood to stimulate new collagen and to improve the skin quality. Now, to go on to the apples of the cheeks, this is an area that we refer to as the malar fat pad, as well as the submalar space. When someone has lost volume in this area, depending on the rest of the face, I also perform a lot of facial rejuvenation surgery, such as facelifting, cheek implants, etc. And we try to decide how much of it is volume loss from volume going inwards, such as from your weight loss, and how much is it from sagging, from descent. The face, when it descends as one gets older, then if you try to plump it out, then you might not look so good because the skin doesn't have the tone or the resilience to hold that volume. But when we talk about the mid-facial area, augmentation can be performed with a facial implant, such as a submalar implant, or a filler, such as radius Restylane. We also tend to use platelet-rich plasma to further enhance the volume in this area. We also do something called fat grafting. We can take fat from one area of the body and place it into this area to augment it further. So in terms of affordability, what we do with our patients is we come up with different scenarios. As long as the patient understands what those scenarios are and what the costs are, we try to come to a structure that is affordable but will also be satisfactory. A lot of people buy the lower price stuff, such as the infomercial level type of gimmicks and other things, and they end up wasting a lot of money. So high quality and in cost do often go hand in hand, and investment is something in this type of area where you will reap the benefits for a long time. But that being said, there's always options, and as long as you communicate well with your doctor, you should be satisfied. So I hope that was helpful. I wish you the best of luck. Thank you for your question.